Hello, everyone. My name is Robert Carrillo. I am your host for the Cancer Doctor podcast. And today I'm speaking with Mariana Bolaños. She is the senior cancer nutritionist over at Immunity Therapy Center in Tijuana, Mexico. If you've never heard of Immunity Therapy Center, they're also referred to as ITC. They're about 5 minutes from the San Diego border, and they specialize in intervention for cancer, or for those that have been diagnosed with cancer. And they shuttle in patients from the United States every day from San Diego straight to Tijuana, Mexico, about 5 minutes away, in order to provide uh, in in-house care for the patient or outpatient care as well, whatever you might need. They have a variety of treatments and alternative therapies that they utilize. I think the patients are receiving about over 15 different treatments a day there. But one of the central components of their protocols is nutrition, or an anti-cancer diet that is individualized for the patient that they are seeing. And the reason I'm excited to speak with Mariana, I'll tell you folks a little bit about her, is Mariana Bolaños, who is a native of Mexico, has been educated in Mexico, the United States, and also in Germany. And I'm looking at some of her background. She does have a degree in nutrition and food science. She also has a bachelor's in general medicine as well. And she has certificates in plant-based nutrition from Cornell University with Dr. Colin Campbell as well, that focuses on cancer itself. She also has other certification in healthy anti-aging, as well as nutrition in cancer. And she also specializes in diabetes as well. So she has a very broad background. She has visited with thousands of patients now, has consulted with thousands of patients that have been diagnosed with cancer. And so I think that she brings a very unique perspective because she started working in this particular field at a very early age. So without any further ado, Mariana, thanks for joining us today. I'm really excited about this conversation. Mariana, let me start off by asking you this, because there's an audience that has never heard about you. They don't know who you are. You're obviously a young lady. At least you look very young to me. And I want to know what inclined you to get involved with healthcare. Was there a set of circumstances that developed at an early age where you determined, I think I want to get into the healthcare field? That's my first question. And how did that evolve into cancer is my second question.
Okay, so first, when I was in med school, I really liked it, but I thought that I wanted to do something else. So in nutrition, I knew I could have a little bit of medical field, but help to prevent diseases, not only treat them. Because at the end, eating is it's essential. We need it every single day as sleeping and drinking water. So as I started in nutrition, I had to do my internship. And ITC was a very promising hospital because I believe that I could learn and teach new things that I learned in Mexico City. I went to a very good university. It's the first one in whole Mexico in 1972. So the authors of the books of nutrition were my teachers. So I learned a lot of things that I wanted to put into practice. So when I got here, as soon as I finished my internship, Dr. Bautista told me if I wanted to stay and offer me the position here. So currently I've been working here 6 years, and I've learned through the years. I keep on studying, and even the patients have taught me a lot, and I always want to learn in order to help them in getting their prognosis better.
That's fantastic. Thank you. Thank you for that introduction. How does nutrition, at least with the patients that have been diagnosed with cancer, how is nutrition affecting their health? In other words, is nutrition playing a role in them getting cancer? And can nutrition really play a role of reversing cancer? I think that's an important question because we have to eat every day. And if we ask the patient to eat differently, that's a very big request for some people. So once again, what role is nutrition playing on the negative and the positive side of this when it comes to cancer?
I don't want to say that's the number one besides medicine because both are very important, but nutrition is something you put in your mouth every day and it's going to give nutrients to your body. So it's very important to be mindful of what we're eating because sometimes we just put something in our mouth that's processed and it has 100 ingredients or it has the ingredient natural flavors and could be even 100 more. So that those things, since time has changed, even milk, how before time there were cars going every single day passing fresh milk. Now there's carton milks that you can have stored for months. So there's food nowadays that's very processed, and all those additives or pesticides or chemicals in our foods in the long run makes us ill, as well as environment pollution, stress. So nutrition is very important because we need it every day. Right now, I have a patient that has had radiotherapy and also had a surgery, and she cannot swallow down food. It's already been a week and she lost 5 pounds. So today in the doctor's meeting, we have doctor nutrition meeting every week and every day. And I mentioned this patient particularly cannot swallow down food. I think it would be urgent to discuss if we may do a ostomy through the stomach so that we can pass nutrition through the stomach because her stomach works perfectly. So we have to always look for a way to get nutrients in. Of course, later I give an orientation to all the patients on nutrition weekly and I give them a plan so that they can continue this diet because at the end, in food, you're getting antioxidants, your vitamins, your minerals, your energy in order to boost the immune system to recover.
You just mentioned something important that you're doing a nutrition class every week for the patients that are there. What do you discuss in a nutrition class for those patients that they're going to take home with them? What are some of the topics?
So what I learn, what I show the patients in the nutrition orientation is what we avoid on a cancer diet. First of all, we want to avoid carcinogens group 1, already classified by the World Health Organization, the International Agency on Cancer Research, and that's avoiding alcohol. There's no safe dosage. Avoid smoking. Over 20 cancers can be developed. Avoid processed meats, bacon, sausage, salami, and to try to eat more whole food ingredients. I teach the patients how to read labels so that when they go shopping, they know that the first ingredient has the most. So if in the first ingredient we see the word sugar, that's something we want to avoid, or saturated fats. I teach them about all the different type of fats because some patients don't know with what oils to cook with. They don't know what are carbs. Patients come very, very afraid of eating carbs. So they avoid quinoa, they avoid eating fruits. And fruits are vital. They contain a lot of fiber, nutrients, antioxidants, which prevents DNA damage. So I teach them about macronutrients, micronutrients, how to read labels, how their plate should look like if they want to follow a more plant-based diet or include animal protein. I teach them about swaps instead of plastic containers to glass containers. Instead of Teflon, cooking with stainless steel. About cooking methods, how to make their own dressings at home, how to make their own soups. And I also create a meal plan giving them how many portions of each food group they should have at least every single day to get all the nutrients that they need.
Wow, it sounds very comprehensive. I think that's wonderful. You said something that caught my attention. You mentioned that you discuss with them foods that are carcinogens. I think group 1 is what you said, correct?
Correct.
And one of the things you just mentioned was processed meats like cold cuts, that they are not healthy for a patient to be consuming. And I'm thinking, at least in the United States, and I don't know how it is in Mexico on a daily basis, but in the United States, we're feeding those kind of meats to our children every day in sandwiches. Um, they're getting cold cuts, and there's cold cuts sold in the grocery store everywhere. Why? What have you learned? Educate us. What is going on with that type of food, a cold cut that is not, it's not beneficial for us long term?
The processed meats that include bacon, sausage, pepperoni, and pizza, salami are processed meats that already have the evidence of increasing colorectal cancer and other type of cancer. So it's not maybe, it's definite that it causes cancer. So those are things that we want to avoid on our household for everyday consumption. Sandwiches, as you said, or in Mexico, a lot of moms put wings, the hot dog, the sausage. They put it with chili and they put it on Ziploc bags for the kids. So those are little things that contains nitrates and on the long run can lead to cancer. So those are things we want to avoid, and there's other type of things that we can avoid as aflatoxins that may be on peanuts, which has been shown to be a high risk of liver cancer, or mate drinks, which is a caffeinated drink. Mainly, they drink it more in Argentina, but also the hot temperatures can lead to esophageal cancer, stomach cancers, or salt preserved foods like olives, anything that comes on the jar with salt also could be a high risk of developing stomach cancer. So there's specific things in diet that I always try to educate the patients instead of saying, you can't eat this. I try to teach them with science. I can show them articles, and that way they feel more safe of the information I'm giving them.
That's wonderful. That's great. Thank you for sharing that with us. You also mentioned alcohol, and that's a big one. There's many individuals that they just drink alcohol socially, right, when they go out or what have you. But what is it about alcohol that makes it dangerous for us to be consuming? And I'm thinking of the person right now that doesn't have a cancer diagnosis, but they drink alcohol. Why is that? Is that going to cause cancer, or is it stacking the odds in that direction? What's going on with alcohol?
So alcohol as a reference, the World Health Organization on 2019 stated that there were 2.6 million deaths attributed to alcohol consumption. Besides drinking alcohol, which contains ethanol transformed into aldehyde, which is cancer causing, when you drink alcohol, our our brains function differently. We get a little bit more violent, or we may not drive as safely, or there could be different type of accidents. So a lot of deaths in different scenarios, including cancer, one of the main ones, it's included. And there's no safe dosage. Different organizations state that there's no safe. The thing is that as the amount increases, the risk also increases. And some of the main cancers are oral cancer, breast cancer, colon cancer, lung cancer, kidney cancer. There's around 13 cancers related with alcohol consumption.
Wow. Okay. If you're asking your patients to change their lifestyle via the food that they eat on a regular basis, and it's a radical change for them. Um, how long is it generally going to take the patient to adopt that lifestyle? Like, in other words, where it's not a fight. They're not having to fight it anymore. It's becoming something they enjoy more. What have you seen by experience? How long does that normally take? Because there's a patient watching this going, there's no way I'm going to give up my cold cuts or my alcohol, and you're asking them to do so. How long is it going to take for that change to really stick?
What I've noticed on the patient, and also interesting, the companions, since the companions also eat here at ITC if they want to, which usually they do, they they see so much difference in if they had to take medications that with this kind of diet, because of the fiber, the nutrients they have, and the patients, the results they have, they want to continue this diet. At the beginning, I'm kind of like a mom where they're like, no way, and no, and I'm used to this, I'm sorry. And then I have to also respect, I say the information I respect so that they don't feel more stressed. But later, they start seeing all the benefits from this diet that they keep on coming to my office, asking guidance, asking for recipes. So I give them all the information so that at home they can continue this. So usually on these 3 weeks, patients I've noticed create the habit of eating healthy foods, and your brain, you might think that it kind of forgets the craving for salty food or sugary things. People that were used to creamers on their coffee or sugar in their coffee, since we don't have that at ITC, they start forgetting they need it as part of their diet and seeing the benefits. they want to adopt this lifestyle afterwards.
I have a question now pertaining to all this. Have you found, or in your research or the things that you're learning, are people eating too much? Are they just in general consuming too much food? In other words, can can people that don't have cancer, as an example, can they go with eating a less volume of food? Not, I'm not talking just the wrong food, but even if they were eating the right food, is it necessary to eat 3 meals a day or 6 meals a day for people that don't have cancer? And then the individual that does have cancer, same question. Does the volume of food contribute to health and wellness? Is my question.
This is a very interesting question. So, each person has different dietary requirements. That's why it's very important that each person assist with a nutritionist, and more if you have a cancer diagnosis or any type of autoimmune disease, because whenever we have any kind of disease, our body naturally is fighting that, so we are burning more calories. And the risk here is of losing muscle mass, which is mainly how cancer patients arrive, and they follow diets that they see on the internet, like keto diet, and then we have less muscle mass and higher risk of having a bad prognosis with the treatments. The amount of food can be different because an example is one small bag of chips could equal 3 apples. So depending the quality of the food, the volume. Anything that's going to be processed, it's going to have saturated fats in order to have a longer shelf life. So every gram of fat has 9 calories. So the calories of processed foods, even though the volume is small, is going to be larger. And since it has saturated fats, additives, higher risk of developing diabetes, high blood pressure, cancer, other type of diseases. And the timing of the food depends on each person. Let's say that you have a gastric surgery. Even though I wish I could give you the whole calories at once, your body cannot tolerate it. Or maybe you have a stomach cancer and you cannot tolerate a full meal. So I had to do portions, smaller portions, so that you get the 100 calories, but maybe in 2 parts, or maybe even on 3. So each patient is different. Also, there's fasting. Regarding the fasting, it depends on each patient, because if the patient comes with cachexia, and even though they want to fast for chemotherapy, that wouldn't be ideal, because maybe sometimes with chemotherapy you get side effects and your taste buds change, your appetite decrease, you have nausea, and you won't eat maybe for a day. So that would be, it's a hard question because that answer would be personalized for each different person, and I had to see lab work and let you know my professional opinion.
You mentioned the word cachexia. For those that have never heard it, could you please describe a patient with cachexia? What does that mean?
Cachexia means that when the patient is losing around each week or every 2 weeks 2% of its body weight, and you can even start noticing the structures of their bone. Even though maybe their body fat percentage is not very different, but the muscle mass is decreasing. So we have less muscle mass, maybe more fat percentage, and the energy levels are low. So your body's on high catabolism, that you're burning a lot of calories, a lot of muscle mass. And cancer on its own requires protein, so it's breaking down your muscles, and your body's constantly fighting this breaking of energy.
That makes sense. Yeah, I just wanted to clear that up for anybody that is watching this and has never heard that before. Okay, so what I'm hearing you say is that really when it comes to the volume of food, if you're consuming junk food versus real food, like you gave the example of apples and a bag of chips, it would take 3 apples to make up the volume of the chips, as an example. One of the interesting things about junk food is they're packed with a lot of bad stuff in a small package, but to get volume out of real food, you're generally having to consume a larger salad or more apples. Is that correct? Did I hear that correctly?
Everything that is whole food ingredients, whole grains, vegetables, fruits, calorie dense, they're very small. Any processed food, since it's going to have naturally a lot of added fat and other ingredients, is going to be more calorie dense, but more empty in nutrients.
Can you give us a story from your career with a patient that was diagnosed with cancer, comes in with this condition where changing what they eat made a significant difference in their response to their treatment, right? Because obviously, food is only one component of what you're doing there at Immunity Therapy Center. But can you think of a story where, wow, food really changed the response with this patient?
The first more noticeable things we've observed is that on cancers such as pancreatic cancer, usually patients have diabetes induced. So they usually have to have either insulin, metformin, different types of medications. So while following ITC diet, which follows that criteria of only having whole grains, no sugar, low glycemic index foods, their requirements for the dose of medication decreases significantly. And when they have their glucose monitors, we can also observe that. And in their lab work, sometimes patients that follow a keto diet before coming with us and they had cholesterol, triglycerides, protein C elevated, the numbers decrease. So overall, health-wise, patients that come with inflammation or some type of disease besides also cancer, that changes radically in a positive outcome.
Okay, and just to restate this once again for the viewer. So what you're saying is patients come in, you gave the example of pancreatic cancer. Patient comes in, is on medications, they have diabetes, they change their diet. Well, they don't need as much medication, or maybe they're coming off of it because their diabetes is improving, as an example. And I think you mentioned keto more than once now. So I want to clarify this because someone's thinking about it. So does keto diet, in your experience, is it influencing uh, worse conditions? Is that what I'm hearing? Because it sounds like once you change the diet profile with a keto patient, their blood labs improve, their markers improve. Is that correct? Talk to us a little bit about the keto diet and your professional opinion about it. And I know diet's a very broad topic. Everyone has their favorite diet, and I'm not here to endorse one particular diet. I do, we want to see patients get on a good meal plan, right? That's going to improve their health. But what's your professional opinion regarding the patients coming in that are on a keto diet or want to get on a keto diet? What does that look like?
Talking about diets that I want to mention this is that patients have come with Gerson diet, keto diet, paradox Dr. Gundry that they avoid nightshades, they avoid seeds. They come reading the book of Chris' work, The Metabolic Approach to Cancer. In the keto diet, usually the patients that come, it's because they've seen it through the internet, through a video, or a doctor said to follow that diet, but they don't have a nutritional guidance and they don't follow it as it's supposed to be. And around 95% of the patients that come following that diet recently has noticed a significantly decrease in their weight, their energy levels, and their muscle mass. They feel like they don't have the strength as before. And on the lab work, we noticed high cholesterol, triglycerides, inflammation, and at the end, high risk of cardiovascular disease. So this type of diet, I've noticed in my professional opinion that is not beneficial for the patients, or at least they're not following it as a book says or with a nutritional guidance. And the other side that I can show you and tell you is that there's no one specific miracle diet. The combination of eating whole food ingredients as natural as possible, having nutritional guidance, avoiding carcinogens, combining it with alternative therapies, we get the best outcomes.
Got it. Thank you for clearing that up because, one of the things that you're saying, and I would agree with you that, diets have to be individualized for the patient, first of all. And if you're in a health crisis, you want professional guidance. It's one thing to get on the internet or read a book, and that's fine. But, consulting with someone like you is going to it's going to be different. We're going to get down to the the individual themselves and what their needs are and how to tailor that diet. I know with the ketogenic diet, there are different versions of this diet as well, it appears. And without patients having some clear guidelines and sticking to the specifics of those guidelines, well, they might feel the way you're mentioning, losing weight, low energy, uh, and just not feeling the spark in their life anymore, right, on a day-to-day basis. So, thank you for clearing that up. Are there certain, besides the cold cuts that we discussed and the alcohol that we discussed, are there some other types of foods that patients should just not, they should stay away from that after they've been diagnosed with cancer? It's like avoid that all the time. There's no need to put that in your mouth. There's no need to drink that. Is there anything else that they should be conscientious about?
Yes. Recommendations would be to stay away from sugar, sugary drinks, sodas, juices, all type of processed juices, even though on the front cover it says no added sugars. On the back, you'll notice probably has 50 grams of sugar and 0 grams of fiber. So remember that fiber is very important to prevent sugar from spiking. And mostly processed juices are going to contain high amounts of sugar, and we're going to absorb it, and sugar spikes, higher risk of other type of diseases. Besides sugary drinks or cookies, donuts, any carb that's fried. So a piece of potato, but you fry it, frying your food, high saturated fat, and also if the frying gets to a point where it turns quite brown, it's called acrylamide, which also could be a cancer causing. So those are things we want to avoid. Also, dairy. So dairy, we as humans, there's not one thing that we need dairy for. When we are newborns, of course, we need breastfeeding from our moms, but other than that, we don't need milk, cheese, butter in our diet. We enjoy it, but we don't need it. We can get calcium, vitamin D through other type of sources, sesame seeds, spinach, almonds, so on. Alcohol, as we said, smoking, processed meats, as we said, bacon, sausage, salami, and red meat. It's something that is quite hard for the patient, but red meat is classified as probable cancer causing. So it's still on studies, but it's been linked with high risk of developing colon cancer. And nowadays, it's very sad that we've seen it with very young adults. And combining it with alcohol and red meat and grillings, for example, when it's on the weekend and we do barbecues. So all the smoking, buying smoked meat, creates a chemical called polycyclic aromatic hydrocarbons. This smoking in the black spots in the meat causes cancer. So there are several cooking methods that also are important to discuss. And of course, trying to avoid processed foods. Nowadays, we go to grocery shopping and all the aisles are packaged foods with additives, with colors, with a lot of ingredients. So we need to start going back to basics, start cooking. You can even freeze food, buy frozen vegetables. It's always best to get everything fresh, but convenient wise, as long as we do more natural ingredients, that's what we want to go for.
Sugar is kind of strange now because there are other things that are processed sugars, but they're not called sugars. They have other names on the labels on packages, or there's substitute sugars that are being sold all the time because people hear about sugar. So, are there some other products that you can name that are really replacement sugars that are toxins? Are like, yeah, you shouldn't eat that. That no, that's not a good, because when you say sugar, I'm thinking processed sugar. I'm thinking about like sugar cane, the white sugar, right? But I'm aware that there's sugars by other names that are not healthy. Can you name some of those for us that off the top of your head?
Yes, aspartame, cane sugar, corn syrup, and there is some that are called polyalcohols. They end like alcohols, xylitol, erythritol, malitol, all the ones ending on OL, polyalcohols, above only 5 grams, which is a teaspoon, have the side effect of creating cramps, bloating, gases, and can act as a laxative. So imagine having a patient doing oral chemo or oral medications, and they usually have a little bit of ascites or edema, and this type of sweeteners, sugar-free promising, don't know that they have the side effects, and you feel worse. So it's important to know to try to avoid them, and they're mainly on things like gum or on monk fruit. So monk fruit, let me tell you that that's a safe sweetener as long as on the ingredients it's only monk fruit. And usually on all the store-bought ones, the first ingredient is erythritol. Let's say from 100 grams, 97 and only 3 grams monk fruit. So as long as it's only monk fruit, that would be safe. Another alternative would be stevia leaf. So stevia, it's a plant. It's green colored. So if you get the plant and you get the leaves, you let them dry, you blend them, it's going to be a green powder. So that's going to be a safe alternative for sugar.
So basically, almost, it sounds like almost all those substitute sweeteners, they're really not good for any of us to be consuming. And I know the grocery aisle has those sweeteners, it's on the wall. So is there data that shows that there's particular types of foods that contribute to longer lifespans? Does that data exist? Talk to us about that for the viewers.
For a longer lifespan and saving the environment, plant-based diet, including more whole grains, purple potato, sweet potato, quinoa, amaranth, brown rice, vegetables, kale, broccoli, cruciferous vegetables has the most antioxidants and cancer-fighting ingredients. All the colors of the vegetables, even carrots, vitamin A, tomatoes, bell peppers of different colors. We shouldn't avoid vegetables or fruits. Fruits are usually a topic that patients are scared of them, but they're actually going to give you that boost of energy to boost your immune system. Vitamin, minerals, strawberries, all the berries, blueberries, what I would say are the number one. All the type of seeds, legumes, beans, lentils, let them be your source of protein and start decreasing more the animal protein and including more whole grains, whole foods.
Why are the patients so afraid of fruits? What is it about fruit in particular that they're scared about?
They're scared that fruit at the end it's glucose, which is sugar for the patients, and they are scared of feeding the cancer. But in our bodies, when we're sick, we are not only cancer in all our body, we have healthy cells as well. So in order to boost the immune system and give those healthy cells the properties, antioxidants to fight the free radicals, the DNA damage, we need fruits. If not, we're going to have to get it through powder form. And what best to just get it naturally through food. So all the berries mainly are the ones with the most antioxidants, but the rest of all the fruits are also very good. So each one of the colors in our food is going to provide different type of nutrition, micronutrients important for different organs and different systems in our bodies. So we shouldn't be afraid of fruits. I would professionally suggest to eat more fresh or frozen fruits than dehydrated. An example is one single date, it's going to have 10 grams of sugar, only 1 gram of fiber. And a full cup of strawberries is going to have 6 grams of sugar and 3 of fiber. So remember, fiber helps that the sugar doesn't spike. So I could almost eat 2 cups of strawberry versus only 1 date. So actually the calories or the sugar in fruits is very small and it's going to have high fiber versus eating dehydrated or pureed or concentrates that are usually on processed juices.
That's helpful. That's helpful because, yeah, I've heard that as well. Patients get concerned about the sugar in fruits. And though it's a natural sugar, what you're also saying is that the volume of sugar from a fruit doesn't compare to processed sugars, right? Or even
Right.
natural sugars like in a date. But it's also very interesting that patients might be getting away from eating fruit, but yet they'll consume a lot of substitute sugars that are not good for them as well.
Exactly.
So much of this seems to be education. The patients need to be educated. The patients that you see, what percentage of them in your professional opinion, really get hooked on food education? In other words, they really want to be educated about the food from the nutritional aspect and how it can help them in order to change their life. Is that like 10% of the patients you see? Is it more? What is it?
I would say it's around 90%.
Wow. I didn't expect that.
The
So
other
you're
10,
saying,
the
yeah, go
other
ahead.
10%, I would say because they have cultural beliefs and it's part of their diet, doing dates, honey, or it's part of a lot of Amish communities. They have their own cows, their own milk, their own cheese. So it's very hard cultural wise to take certain things out of their diet, but usually most of them wants to do an effort to continue this type of diets because of the improvements they saw.
So 90% of the patients you're saying that you see really want to be educated about food. They want to change their lifestyle. That's encouraging to me. I didn't think it would be that high. I thought maybe 30% is what I thought, but that's great. Okay. If people start eating well, you mentioned about a reduction in medication, that's something that could happen, that could change medication. Does the same hold true for supplements then? Does that mean that if I'm eating well, I may not have to consume certain supplements? Or I guess what I'm getting at is some people try to get nutrition through supplements alone. But I'm thinking, shouldn't it be food? I mean, shouldn't we get supplementation from the food? What does that look like?
Talking about supplements, there is a high risk of developing lung cancer when you have supplements such as beta carotene and other type of supplements. With a cancer diagnosis, we shouldn't supplement unless we do lab work and your medical doctor prescribes specific micronutrients that you need. Other than that, having a complete balanced diet with the guidance of a nutritionist, you shouldn't have deficiencies. If you follow a healthy eating plate with different type of vegetables, your macronutrients, carb, protein, fat, you wouldn't have, unless you're at a certain age where above 50, we start not absorbing as much as when we're younger, or if you had a gastric surgery, maybe you need more B12, you need zinc, vitamin D. It depends on each person. Also, it's personalized if you do need supplements or not. But the recommendation is eating it through diet.
Okay, that was helpful. So the main takeaway that I got from that was if I've been diagnosed with cancer, I should hold off on taking a lot of supplements until I've been evaluated by my doctor, run some tests, some labs to find out what I might be deficient in, and then at that point in time, take the supplementation that my healthcare professional is recommending that I take based upon my diagnosis of cancer. Is that correct?
It is correct. Also,
Okay.
their supplements, it's important to mention that they can interact with medication or even with certain type of foods. So sometimes we just take supplements because nicely a friend close to us told us to drink this tea or have this supplement because it worked for somebody else. But let's remember that each one of us, it's different type, female, males, different age, maybe different type stage of cancer. So we shouldn't take supplements just because somebody recommends it unless it's through prescribed by medical or your health care team.
Is there anything that can make the food that I eat work better from a nutritional aspect? I'm thinking to myself, for example, exercise. We hear a lot about exercise, um, and how that interacts with the food that we're consuming. But is there anything besides exercise, or maybe it is exercise, that can make eating more beneficial to me? Is it a nap after I eat? Is it, you know, not going to sleep right away? Is it exercise? Is it the times that I eat? How can I make eating more beneficial is my question. How can I get more out of my food? Is there anything that I can do?
There are several tips I could give you. First of all, is not to have coffee on empty stomach. Always let the first food in your stomach be something nutritious that's gonna nourish your body. And then wait at least 20 to 30 minutes to do the coffee because coffee inhibits the absorption of iron and other type of nutrients. Then, if you're gonna do physical activity, I would suggest to do one portion of fruit prior in between 1 hour before exercise so that you have the energy and the endurance to do your physical activity. And let's say that you had a large meal one day, you're really hungry. And sometimes we experience we're a little bit sleepy afterwards. So it's always recommended to walk at least 15 minutes after a large meal so that our sugar doesn't spike and our body starts using that energy. Also, before going to sleep, we shouldn't eat at least 2 hours prior to sleeping so that our body rests and we prevent gastric reflux.
Okay, that was helpful. And again, I want to just for the audience here, these comments are being made within the context of a patient diagnosed with cancer, right? Just so that they're aware, right? We're not steering off of that. Um, are there books that you have read that have been really beneficial to you personally in the area of nutrition that you would recommend that a patient reads? It doesn't mean that everything in the book you're endorsing, but where you found there was some wisdom, in that book that you think everybody would benefit from. Are there some books that you would like to recommend?
Chris' work would be one. I like certain recipes of juicing and plant-based and how he also mentioned spiritually his testimony. The metabolic approach to cancer, I wouldn't agree with 50% of the book, but the other 50, there's things that I found were beneficial. Dr. Greger, I would say 100%. His books, How Not to Die, How Not to Diet, How Not to Age, very good books. And always, as a reference, look for scientific articles at least 5 years recent. On the internet, if it's not a scientific article, I wouldn't trust totally what I see on a podcast or on the web.
Okay, that was an important one. So you really rely on some of the latest data, the latest findings that from the scientific community, 5 years or so. Is that because just the data is fresher, the studies are fresher? Is that why? Because they're more recent?
They are, and they also use even previous articles and they put it on the reference, but they compare new data with older and they make new information more up to date.
Okay, got it. And you've been really generous with your time, and I appreciate it. I'm coming to the end now where I want to ask just maybe a couple more questions here. Do you have a personal testimony? I'm speaking personally for yourself now, where food or some lifestyle change that you made an improvement on your health. Is there anything that you could, as a source of encouragement to those listening to this, could take home with them, right?
Yes, in my personal experience, I can say that with working with cancer patients, I always guided them on how to eat properly. But honestly, in my diet, I wasn't as strict. And I had polycyclic PCOS.
Okay. Yep.
I had PCOS, so I had irregular menstrual cycles, a lot of acne, red flushes, and I was a little overweight. My lab work, I had high cholesterol, high triglycerides. After working here and noticing how life is valuable and that eating can change and help cancer patients, I thought, why not? Maybe it can help my PCOS. And literally on 6 months of following a plant-based diet, my menstrual cycle got regular. I had a lot of acne. I can send you pictures if you want to see them. And rosacea, that went away. My lab work came to normal triglyceride cholesterol. Even before, I always was thin, sometimes overweight, but thin, and I was always high cholesterol. I thought it was family history, but it was diet, definitely. And my overall health, I got happier, I got more into sports and running, and overall, I believe that since I experienced it, it helped me to tell the patients when you go to a restaurant how you can order. So eating like this helped the environment, helped myself, and in the future, so I can be a mom.
That's fantastic. You just said something there at the end that it also helped you uh, to learn what to order when you eat out. So, did I hear, are you saying to me that a cancer patient doesn't have to give up going out to eat? They can still go out to eat if they know how to put the meal together or how to?
Of course,
Okay.
they can
All
go
right.
to restaurants, they can go to family gatherings. The most important thing, number one, is to prioritize colors. Have fiber, so salad or a soup, vegetables. That fiber is going to help that whenever you eat your protein or your carb, your sugar won't spike as high. So we prioritize vegetables in every single meal. And then you always want to include a portion of protein, a portion of carb, and of healthy fats and drinking sparkling water, regular water, but nothing like sodas, alcohol.
Okay, wonderful. All right, so I have one last question as we're wrapping it up. And this question, Mariana, comes from a previous guest. We ask our last guest to ask a question of the next guest. So here's the question I have for you from a previous guest. What do you professionally, what would you like or what do you wish that more cancer doctors knew? What do you wish they knew more about that they don't presently know about? In your career, what do you wish doctors knew more about?
I wish doctors knew more nutrition information because 95% of the patients that arrive, they quote that the doctors told them to eat whatever they want, just not to lose weight. If they want an ice cream, a burger, it doesn't matter. When we know that there are certain foods that can create more cancer and be more cytotoxic while doing certain type of alternative therapies or chemotherapy. So my wish would be that doctors would have more studies in nutrition in their bachelor so that when they have a cancer patient or any type of patient, they can try to revert the disease through nutrition as well.
Got it. Thank you so much. Yeah, that's a good one, right? Yeah, I think we all wish that doctors knew more about nutrition. It's a shame that they don't. But that's why we have professionals like yourself, right, to help us out. So we really appreciate that. In closing, for the audience, if you want to get a hold of Immunity Therapy Center, and if you would like to enroll there, where you will obviously end up working with Mariana Bolaños on nutrition and all, I want to direct you where you could find them. First of all, Immunity Therapy Center, you can find them on cancerdoctor.com. They are a partner center, which means that I go out to the facility on an annual basis to evaluate what they are doing on site. They've received our highest seal of approval, which is the Partner Center. So you can find them on cancerdoctor.com. You can also find them on their own website, which is immunitytherapycenter.com. That's immunitytherapycenter.com. You can find them there as well. And they do offer free medical doctor consultations, and you can telephone them for a consultation at area code 619 929 3430, and you can schedule a medical doctor consultation. I believe that you can telephone them Monday through Friday from 8 a.m. to 6 p.m. Pacific Standard Time, and you can also reach them from 8 a.m. to 4 p.m. on Saturdays Pacific Standard Time as well, and they'll be happy to schedule you a medical doctor consultation. Their lead medical director is Dr. Carlos Bautista. He has more than 25 years of experience in this field. Mariana, once again, thank you so much for the work that you're doing and for how you're helping patients and for the continuing education, because we all need to learn about this. We really do appreciate your time today.
No, you're welcome, Robert. I'm very glad, and I hope that at least this videos get to one person and it helps them.
All right, thank you. You have a great day now.
You too.